Hello, good morning, and welcome back to my channel. We have been talking about women's health, we have been talking about health checkups, we have been talking about cervical cancer. Let's talk about IVF today, and more than IVF, let's talk about its failures and why failure occurs. The most disheartening and disappointing aspect of IVF is its failure. Wherever you go, whichever part of the country, whichever part of the world, the success rate is just 40 to 50%. Why is it so poor? It is nature. Even when a normal couple conceives, the embryos which get implanted is only 50%. The rest 50% are either abnormal or will not get implanted. So how can we expect when we do something artificially, that is assisted reproductive technique, to get 100% results? When we have an IVF patient, there are three aspects which contribute to the success of IVF. One is the passenger, that is the embryo. Second is the passage, that is the uterus. And third is the place which it is done, that is the lab. So the passenger, passage and the lab are three important aspects of the success of IVF. Let's talk about the embryo. The embryo has to be healthy. Whenever we do IVF, it is due to some reason we are doing IVF. In a normal couple, we will not do IVF. So when we take the egg and the sperm, both have to be healthy, and when they unite, the embryo formed has to be also healthy. Like if you have a fragmented embryo, if you have a vacuolated embryo, if you have a lot of degradation in the embryo, then the embryo will not get implanted. Always the success rate is better with blasts. Of course, even day 3 healthy embryos also will get implanted. Sometimes to get better results, we do a sequential transfer, that is day 3 and day 5 transfers. So when we do this, we do expect another 5% better results. Now coming to the cavity, that is the passage. Now the passage has to be very good. When we say the passage is good, our endometrial thickness on the day of transfer should be 1 centimeter. Vascularity has to be zone 3 and 4. The progesterone levels has to be below 20 or around 10 to 20 on the day of transfer, that is day 5. Then we say, okay, it is most optimal for the embryo to get implanted. In spite of having all these, we do get failures. That is basically because we do not know how healthy is the embryo when you have the genetic composition, whether there is aneuploidy, whether it is an abnormal embryo, whether there is chromosomal aberration. So all these things we don't know about an embryo unless we do a PGT. And we do not routinely do a PGT because it works out even more expensive than an IVF cycle. And what about the passenger and the cavity, that is the passage? See, when we have the passage, there are so many factors which get involved in implantation. And whatever we do, these are the external things which I have told you, that is the endometrial thickness, then the vascularity, progesterone levels, but the factors responsible for implantation, if they do not function properly, then we do not get pregnancies. That is the microscopic and the electron microscopic level of pinapoids, the PGE2, the tumor necrosis factor. So to get all this, we do a stem cell therapy. Then of course, the other factors like the adenomyosis, fibroid, endometriosis, thin endometrium, all these contribute to our failures. So we have spoken about the passenger, the passage and the lab. The lab has to be in very good condition. Your incubators have to be good. Your lab working condition, cleanliness has to be well maintained. Now, how do you calibrate your lab, or how do you say that your lab is very good? If you are getting blast cultures in your lab, then you know that the lab is excellent. So please have a junior embryologist to look after your lab, and once you get good results, that is the embryos are good, then of course all these should synchronize and then you get pregnancies. Thank you so much for your kind attention.